regular sauna use is strongly linked to reduction in systemic inflammation, which is a root driver of gum disease. Routine sauna bathing was also associated with a 50% drop in cardiovascular mortality. 30% of adults breathe through the mouth at night, leading to a dry mouth, which increases then the gum inflammation. A lot of patients ask me, do I have to worry about my metal fillings? Do I need to work on heavy metal detoxing if I have those silver metal mercury fillings? And the answer really depends on each case, but as a general rule, we see that. I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. So welcome back to our part 3 of our 4-part series, where I'm going to talk to you today about natural therapies to improve your oral care. If you've ever experienced the soothing warmth of sauna, you know that's something more happening than just relaxation. Sauna therapy has been used for centuries in parts of the world, like Finland and Scandinavia, not only as a cultural ritual, but as a true medicine for body and mind. So what about oral health? Recent science shows regular sauna use is strongly linked to reduction in systemic inflammation, which is a root driver of gum disease and a cascade of chronic illnesses. For example, in a landmark Finnish cohort study of more than 2,000 men, those who used sauna 4 to 7 times a week had markedly lower levels of C-reactive protein, which is a marker for inflammation linked to both heart and gum disease. Routine sauna bathing was also associated with a 50% drop in cardiovascular mortality and other systemic inflammatory diseases. That connection matters for your mouth. Chronic gum problems are essentially local manifestations of the same inflammation that triggers heart attacks, strokes, and autoimmune flares. Lowering inflammation through sauna makes your body more resilient and helps you heal faster after dental cleanings, surgeries, or even infections. It doesn't stop there though. Sauna use boosts circulation, bringing healing nutrients and immune cells deep into gum tissues, which accelerates the clearing of waste byproducts that bacteria have released there. Sweating is one pathway by which toxins, including heavy metals, exit the body, which may be especially relevant for patients with older amalgam fillings or those working on comprehensive detox protocols. Many of my own patients who combine regular dental hygienes and supplementation, as we discussed on our previous episode, with sauna therapy tells me that the gums look less swollen, the jaw recovers faster if they have any jaw aches or pains after implants or surgeries, and just as importantly, they simply feel better. They feel more confident about themselves, and they feel that they're looking after themselves in a more comprehensive way. I personally use a sauna at least 3 to 4 times a week, which I'm going to put the description on the link below of the sauna that I have at home and of some saunas that I recommend depending on which part of the world you're in and watching this video today. So of course, sauna isn't for everyone. If you have an unstable heart, high or low blood pressure, or if you're pregnant and have kidney problems, you should consult with your doctor before starting making use of saunas daily. And as always, I cannot talk about sauna and detoxifying through sweat if we don't talk about hydration. I definitely want to bring this to your attention because the intake of water and the quality of the water that you give to your body is directly related on the functions of your body perform and how you detoxify. Let's talk about sunlight. Sunlight isn't just for plants or the vitamin D days, as some people say. It's a critical and natural way your body supports oral resilience. Let's be a little bit more specific. Multiple robust studies, including a 2018 review in the Journal of Steroid Biochemistry and Molecular Biology, link vitamin D deficiency to increased risk and severity of periodontitis and dental cavities. As I mentioned on the previous episode, those with optimal levels of vitamin D generally have lower rates of gum disease by at least 30% and mainly stronger bones. So how does it work? When your skin is exposed to sunlight, it makes vitamin D, which in turn allows your gut to absorb calcium, the main mineral in bones and teeth. Vitamin D also triggers production of antimicrobial peptides in your saliva, which is nature's germ fighters. Getting 15 to 30 minutes of sun on your face and arms, or even on your whole body, several times a week is enough for most people. But if you have darker skin, or if you live at a northern latitude, or are mostly indoors, you may need more, and a supplement might be your best backup. Check your vitamin D with a blood test so you're supplementing wisely and not just guessing. If you have a history of oral cancer in your family, know that low vitamin D is linked to higher rates, not just for oral and gum issues, but for malignancies in the head and neck as well. So a little sun taken safely pays dividends far beyond aesthetics and a tan skin. So on this part of the episode, I want to talk to you about EMF exposure, grounding, and smart tech use living in a tech-driven world, which means we are surrounded by electromagnetic fields, also known as EMFs. From Wi-Fi's, mobile devices, household appliances, we have them all around us. You might wonder then, why is this on a dental channel? Here's why. Studies show that prolonged high exposure to EMFs can raise oxidative stress and inflammation. And in the body, that plays a big role in all responses of our systems, especially in those with metal dental work that could act as conductors. That becomes a focus. Practical changes help a lot. Use speakerphones or wired headphones instead of holding your phone to your ear for long calls, especially if you have metallic dental appliances. Put devices on airplane mode during sleep and don't sleep with your phone under your pillow. Avoid excessive blue light before bed. Blue blocker glasses or app filters are widely available nowadays. Now, grounding or earthing. What does that mean? It means the physical connection with earth, walking barefoot on grass, sand, or soil. Several randomized clinical trials and case studies confirm that grounding reduces inflammation and improves sleep quality, while it also helps to normalize cortisol levels. One trial study found that after just one night, participants had better heart rate readings, a sign of improved resilience and healing. While not all the science is settled, these gentle, low-risk strategies are worth trying, especially if you already make nature time part of your mental health routine. Have you ever heard about bouncing? Let's talk a little bit about bouncing here. Bouncing is a favorite, or some people call it rebounding. And it's not just a child's play. We have something that's called lymph, which is a clear fluid that bathes our tissues and carries away waste, bacteria, and toxins. But it doesn't have its own heart that pumps and relies on muscle for movement and flow. So that those fluids move depending on how much movement our body is taking or having through massage and other things. Using a mini trampoline, which is we call a bouncer, and I'm also going to put a link on the description below for you to make this easier if it's something that you want to implement. Using a mini trampoline or even gentle jumping jacks can boost lymphatic flow by several times the baseline, which helps clear inflammatory mediators from not only your body, but also targeted delicate tissue on your gums and jaw. A study in the Journal of Sports Medicine and Physical Fitness showed short daily spells of rebounding, improved immune responses, and reduced fluid overload in participants, an important consideration for anyone recovering from dental infection or procedure. And it's just fun. If rebounding isn't your thing, dancing, brisk walks, or even stretching also supports lymph flow. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. Another very important topic on this episode is the oral gut axis. And let's talk a little bit about probiotics, fermented foods, and the microbiome harmony. If you haven't watched our first episode, go back and watch that. On that episode, I discuss with you and I expose to you why this is so important. What is the role that the oral microbiome plays on our gut and on our overall health? So, talking about this today, I want to explain to you that the oral gut axis is a hot topic in research and it has strong evidence to be so. Evidence now shows that the health of your mouth and microbiome community is intimately tied to your digestive tract. Clinical trials using probiotics such as Streptococcus salivarius, M18, and Lactobacillus reuteri show up to a 40% reduction in gum bleeding and pathogenic bacteria, as well as reduced halitosis. These findings aren't just in theory. Patients with chronic gum issues have seen improvements by adding oral-specific probiotics and lozenges on rinses into their daily routine. One more thing about especially the Lactobacillus reuteri that I want to mention here is that we see a lot of talk about people that breastfeed and how that improves gut health for the baby, but how that also improves the mother. We see that that specific type of Lactobacillus, when present on skin and on our gut, it protects especially women against breast cancers. So it's really, really worth it, having a look and maybe consider start having that specific probiotic. Now let's talk about fermented foods. Fermented foods like sugar-free yogurt, kefir, kimchi, sauerkraut, and other fermented and pickled foods feed not only just our gut, but our good bacteria as well. Choose options without added sugar or preservatives and try to get a variety of types for microbiome diversity. If you're new to fermented foods, add a small amount daily and build up as your system adjusts. If you have sensitive gut, talk to your dietitian, your nutrition, or your doctor about it before you implement any fermented foods. The other important thing is mouth breathing. As we have extensively discussed on previous episodes on our channel, mouth breathing, sleep, and oral health are also very important when we talk about your immune response. So let's talk a little bit more about this on this episode, but if you want to go in more depth, go back and watch our other episodes on this topic. So mouth breathing, especially during sleep, what we see is that the studies estimate that almost 30% of adults breathe through the mouth at night, leading to a dry mouth, which increases then the gum inflammation and a higher risk of cavities. Saliva not only works lubricating, but it also neutralizes acids inside our mouth. It carries antimicrobial peptides that wipe out bacteria. When your mouth dries out, you lose that natural defense. Especially if you snore and wake up with a dry mouth or have persistent bad breath, talk to your dentist or sleep specialist. Solutions might include things like nasal strips, positional therapy, treating allergies, or in some cases, some oral appliances that your dentist can help you with. Restoring healthy, closed mouth breathing at night supports the healing process that runs while you sleep and keep your oral flora in balance. Another important topic that a lot of the times we don't correlate with oral health, and many cases I don't even see people talking about on how it correlates with overall health, is heavy metal and especially our exposure to mercury. A lot of patients ask me, oh, Do I have to worry about my metal feelings? Do I need to work on heavy metal detoxing if I have those silver metal mercury feelings? And the answer really depends on each case. But as a general rule, we see that those feelings do release a lot of mercury in the body. How the body deals with it varies at an individual level, but we cannot deny that there are no safe levels of mercury for the body. So any level of mercury that the body is exposed to is considered toxic for our tissues. So that drives chronic inflammation and hinders healing from oral disease and other diseases as well. What we see with the International Academy of Oral Medicine and Toxicology is that they recommend that when considering the removal of those feelings, you see a dentist that's qualified to do that and has a specific approach. So we minimize the exposure of those mercury feelings to your body. The other things to take into account is what you have on your plate and what your diet is like, where the fish that you eat and the seafood is being sourced from, and other things. So have a look into foods that and the areas in the planet that have the highest levels of mercury in the water and try to steer away. Or if you eat foods from those places, how you can detoxify. So a gentle way to do that is water. Stay hydrated and focus on a liver-supported diet, which means eat foods with a high fiber content like greens, and a lot of antioxidants are really important as well. And as I mentioned before, consider sauna as a therapy because it really helps to detoxify from heavy metals. Keep in mind that detoxing isn't just about a quick fix, but it's about a steady, safe, long-term support that you're offering your body. Now, let's put all this together for your holistic, comprehensive, and yet simple way of looking after your oral health. So making small changes like moving more, having enough sunlight exposure, minimizing your exposure to technology, especially at nighttime, especially when your body is meant to heal and recover while you sleep. Focus on better nutrition, ways and pathways of detoxifying your body have a massive impact and a massive benefit to your smile, but also to your overall health. If you're wondering where to start, pick one of the new habits. Try daily grounding, for example. Walk barefoot, walk in the morning, bounce, have fermented foods, and maybe if it suits better on your routine, have an afternoon sun soak. Notice how you feel when you implement those small yet very effective changes. Then add here to our comments. Let me know how implementing these changes make you feel. Or if you already do any of those things that we have discussed here, please put the comments below. And I want to hear what's your experience. I want to know how you feel when you started making those changes and how that has impacted your life. And if you're curious about the practical tools and supplements check out the comments below. My trusted recommendations are all there, not as a hard pitch, but just as a helpful idea for anyone looking to try what's helped me and many of my patients. I hope this deep dive gives you a renewed sense of empowerment and practical wisdom. Remember, your mouth is the gateway to your body, mind, and confidence. It deserves as much love and attention as any other part of you. On our next episode, you don't want to miss, I'll be going through step by step on optimal oral care routines, how to brush, how to floss, how to tongue scrape. And I want to give you the perfect sequence so you can actually stay on top of your oral health. So I'll see you then. And until then, look after yourself, share this episode, and remember to put on the comments, what do you like best about what we've spoken about today or even on our previous episodes. I'll see you then. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.